if you're looking for the books that I've written, you can go to Amazon or look in any major bookstore, and you'll see these two books here, How to Reprogram Yourself for Success and Cash Crunch to Cash Flow. The book on the right is the one that our licensees use for marketing their services to doctors. It's an educational tool. It's an actual paperback book, about 176 pages, I think. And our licensees use that to go out and speak with doctors and educate them as to why they need our services. This is a way for you guys to kind of get a visual as to what our business is all about. Basically, we have an online web-based medical billing system. We teach you how to go out and find doctors, go through a what we call a practice analysis with those doctors, and then come back with a proposal that shows them all the benefits of utilizing our system. Now, you're the one who's actually doing the medical billing using iClaim system that you see in the upper left-hand corner there, that visual. And as you can see, it's also able to have electronic health records. On the right-hand side over here, the doctor is able to do all sorts of things there, even using an iPad. It's iPad friendly. You can see the buttons are big buttons that are easy to touch with your finger. So that's what our business is all about. We teach you how to go out and build a business, not just to do medical billing, but to actually build a profitable business. Now, if you haven't been to our website, be sure and go to absystems.com, and you'll see a ton of information there that you can learn about our business. But don't miss this orange button right here, because if you take the e-tour, you'll be able to get into another additional, what we call an electronic brochure that goes much more into depth about what our business is all about. We just ask you, for a couple of pieces of information to be able to get to this, but that's why it's behind that orange button. So be sure and type on that. You'll be able to find more about the opportunity, how we help you get clients, the training that we have, the support, the technology that's behind everything, and then, of course, how to get started in your business. Now, if you're doing your due diligence on us or any other business that's out there, be sure and go to the Better Business Bureau. That's what BBB stands for. Better Business Bureau. That's in every major city of the United States. They've been around for 100 years. Go out there and search for American Business Systems, and you'll see that we have the highest rating that they give, which is A+. Now, this is a picture, by the way, of my dear wife, Linda, who actually started our medical billing business back in the late 80s. And this is us standing in our offices here in Fort Worth, Texas. Actually, it's a little suburb called Keller, Texas. But you're welcome to come visit us anytime you want to. Just contact us. I'll give you our phone number and so forth later on in the webinar. And you can reach us anytime. Tell us you're coming down to visit us. We'll make sure that we have time to sit with you, show you anything you want, answer all your questions. And no, we don't try to close you. We don't have anything to sell, folks. All we have is an opportunity, and it's either for you or it's not for you. So we give you that opportunity. Now, one last thing, we do live training workshops I mentioned here in Dallas. Our next one is coming up in February 8th through the 12th. That's only 4 weeks from this coming Monday. So it's really, really close. And so if you want to get a seat in that, there's only 8 seats available. This classroom only seats 20. So when we get that full, that's it. You'll have to go on to the next one, which I think is somewhere either late in March or maybe early in April. But we'll tell you more about that towards the end of the webinar. All right, well, let's see if Albert is actually online with us and can turn on his video camera. Albert, you there?
I'm here. Hi, everybody. Hi, Pat.
There he is, live. Hey, Albert, thanks so much for taking the time to do this today. We've been planning on this for, the last week or so, and I'm just thrilled that you showed up. By the way, this is a picture of you. Do you remember when we took this picture, Albert?
Yeah, we were receiving our certificates back then. That was our last day. Yeah, not necessarily the most flattering pictures of us, but.
Hey, you know what? I am just thrilled that you are here today. You were telling me earlier, Albert, about the fact that you had actually spoken with one of our, maybe that instructor that's right there, Tierney Martins, about the fact that you hope to be on one of these webinars someday, huh?
Yeah, that particular day when that picture was taken, before everybody left the training, we joked around with the 3 trainers, and I actually told them I'm looking forward to the day when I'm finally the one speaking to the other licensees, and here I am.
And here you are, live. Let's see, that was actually, do you remember when you went through training?
Yeah, that was my birthday. I mean, I think the first day of the training was my birthday. was late October, transitioning into November of 2012.
That's right, 2012. So it's been, well, just past 3 years
Yes,
since you went through that training. And so now you're actually sitting in a, I guess, a leased office space. Is that what we're seeing you there?
that is correct. Yeah, and by the middle of this month, we're actually moving to another office, a bigger office, because we need to add a few more desks and a few more computers, and we're very thankful for that.
Oh, that is fantastic. This slide that's coming up is just some of the other licensees that we've done interviews with. Those of you who'd like to hear some other interviews, we have those on our blog there on our website, so be sure and go back and see that on the website. Let's see if I can get back to that picture. I'm going to talk a little bit more about your success and how you got to where you're at. So, hey, anybody who's actually gotten to the point where they've rented an office space, I say that's a milestone. Well, hey, I'm going to open it up for questions because I have a bunch of questions here that I want to ask you, Albert, but this is for the folks who are attending live, and we've got almost about 30 people on here right now, and some still logging in a little bit late, but already. Good. All right. So I'm going to, again, just go by these one by one as they come in. I'll call out your first name, and we'll read these out to us. Okay. So one of the questions is, let's see. Matt says, what did you do to get your first client?
Oh God. Okay, so so we had to go through this training, right? I mean, I had the same training exactly that you had, and there were several methods that we were taught, and I tried most of them. You know, I tried the marketing emails, I tried the snail mails, I tried every kind of chocolate candies, and door knocking, cold calling. I've tried all of those, but there was one takeaway that even during the training, I already knew that was what I was gonna do. I still remember specifically when Cynthia told us one of the tactics here is to be a perceived expert. I had no idea what
yeah, the perceived expert. Okay.
What it was all about when we started this. But one thing that I know I like to do is kind of read up on things. But actually what happened was during the training, we were also taught about having the different social media accounts, but we already know how to use Facebook, Instagram, Twitter, or whatever. But something new that I learned during that day was that I should actually have a LinkedIn account.
LinkedIn, yeah.
I had a basic idea what LinkedIn was all about. It was a professional networking site, but I didn't know how to use it. I didn't have an account, but that was the first thing that I did when I went back home from the training. And then, so I set up the account. I never even went back to correct my profile up to now. I mean, I just set up the account and joined several groups in there, several LinkedIn groups specific to builders, coders, EMRs, and things like that. But what actually happens, I just found out, I didn't know it at that time, what actually happens when you sign up to these groups is that every day you get a digest of everything that was shared to that group. And normally you would consider these as junk emails, right? But I took care to just click on, I mean, each particular group has one digest for the day. So I clicked on them and I just scanned through the headlines. If there's anything that's kind of interesting, specific to the healthcare industry, I would read that. And it's just like 1 or 2 or 3 paragraphs long. But the thing is, I was made aware of these things. Back then, ICD-9 was still in effect, so I learned that ICD-10 would be in effect by October 1st. It was October 2014. Then I learned that it would be October 2015. Then I also learned about the meaningful use incentives. It's all because of those digests. I learned about the new HIPAA laws, and everything I knew was only the first paragraph of each article. I never even read the whole thing. I mean, who has time to read all of these? But what actually happens is when you're talking to doctors, now you have a basic idea of what's new in the industry. And I'm gonna tell you, those doctors, they don't know the details of those things either. So if you don't have the time to read the entire article, neither do they. So
right.
I just had a basic grasp of what's gonna happen, what's new in in the industry or something like that. So I always had something to talk about, and for some reason, they thought I knew something. So basically,
You were truly a perceived expert then.
exactly. So I could say that I would be honest. Oh wait, let me qualify that. I would be honest now that I lied my way to my first client.
Well, hey, we're all look. We're all smart in some areas. We're all ignorant in other areas. You just weren't as quite as an expert as you were perceived to be, but that's okay.
So what actually happened is I sort of became friends with I think at that time around 3 brand new practices, as in brand new. And the thing with brand new practices is that they don't have that many patients yet, so they're not that busy, and you get to hang around in the clinic even though you're not their biller, even though they're not their client, but you get to talk about a lot of things. They're not busy. And because I was the perceived expert, they started asking things. Of course, Google is our friend. So, just pretend that I know something about it. And the thing is, I never forced them to hire me as their biller. So I basically just answer their questions. They know that I have a billing company. But what happens, the good thing is that the moment their biller messes up, guess who's next in line? Because you're the one in the office already. So
Yeah.
that's how I got my first client. And then after the first client, it was always word of mouth after that. But we did try everything that you taught us. I'm sure that there would be people here, licensees here, that are good at marketing through door knocking or cold calling. I mean, we were never in sales. We never had experience, and we were very shy people. Something that we didn't try is going into these networking meetups or something like that. Or I was too shy to do that. I mean, we wanted to do it, but I was too shy. Another thing that we didn't try, we wanted to try it, was to set up a booth. There was a workers' comp fair here in our place at one time, and Army and we were planning to sort of rent the booth from you guys. We saw the pictures. You have some awesome setups, but we're too lazy to stuff around. So I decided I'll just be the perceived expert, and it worked for me.
Yeah, the trade shows, those take a little effort. You're right. There's a lot of work involved in putting one of those together, even though we have the booth and everything already designed for you that you can basically you rent it for, I don't know, our cost of shipping it and back to you. But
Right.
The point is that you tried some of the things that we taught, and one of them worked. That's all that counts, right? Is during that live workshop, we taught maybe about a dozen different ways to go out and get clients. And hey, we tell people, if you just keep trying the ones that we teach, we've proven that they do work. One of them is going to work for you.
And we also, I already told you about the things that we tried from the things that you taught. Well, we also did some things that you did not actually teach, and nothing worked. And I'll give you some specific examples. Okay, so when we got there, I mean, part of the package is to have this website, right? And, back then we were still these idealists. When we went back home, we said, we don't want a website like this. Everybody else has something like this. So we actually spent some money having somebody design a new website for us. We tried to put our own verbiage in the website. Nothing worked. And right now, you can't even find my website. It got hacked or something. Right now, we are actually planning to go set up the backup of the website that you made for us. Another thing is this. So you gave us part of the package or the marketing materials, right? So we can order these. We have a specific amount that we can order our first set of postcards with. And of course, we use that. We ordered the postcards. We were once again, we were idealists. We want our own. We want to have our own design. So yeah, we hired somebody to design our own our own postcards, our own brochures. Not a single client came back using those brochures. And looking at the postcards that you gave us, Everything was concise. Everything was there. So we learned our mistakes, but we learn from experience.
Well, that's, we tell people you can go out and do your own thing and reinvent the wheel if you want to and spend some money. But what we've designed has been proven to work, so.
Right. And I can still show you one of the postcards that we designed for us.
Oh, yeah. Behind every successful doctor is a patient biller. Oh, clever. Well, it's clever.
Well, just one of several designs that we had. I can tell you some of them. We had them designed, customized for us. We even had them trademarked so that nobody else would use it. And we used taglines that in the end, it turns out that only us thought that they were cute. We had taglines like, behind every successful chiropractor is a crack dealer. Behind every successful oral surgeon is a biller with teeth. Behind every successful ophthalmologist is a biller with vision. Behind every successful obstetrician is a biller that delivers. Behind every successful podiatrist is a biller that kicks. Behind every successful neurologist is a biller with nerves. And behind every successful cardiologist is a biller with heart, and so on and so forth. But the thing is, you can't have just 10, 20 postcards printed of each design. You need to, they will only print 1,000. So we spent a lot, and none of them worked. The postcards that you provided us were still the perfect ones, and I still have copies of them here. You always have to go back to the basics someday.
Yeah, that's right. Sometimes it's better just to accept the fact that we have been doing this for 20 years and kind of know what we're doing. Yeah,
exactly.
Well, that's a good testimonial. Hey, okay, so let's see. Let me look at the questions here. Here's one from Andre, a natural one, I guess, at this point, since we know that you had at least one doctor. How many doctors do you have now? How many providers?
Well, okay, we're billing for 10 practices right now. And there's a total of 44 providers across these 10 practices. And I would say there would be 35 actual doctors because a few of them are actually part of 2 practices or more. But the short is we have 10 practices with a total of 44 provider accounts with iClean.
Good. And let's see, George wants to know, what was your background prior to starting your business?
Oh, yeah. So Arby and I, we were both doctors in the Philippines. I was a surgeon. She was an internist, and we moved here in 2005. But having said that, actually, the only thing related to our background that made us do this business is because it's medically related. But other than that, medical practice back in the Philippines is totally different from here in America. And back there's no such thing as a medical biller. That's not an industry. Medical practice there is very simple. Like, you have a clinic, there's we call them medical secretaries up front. We don't have medical assistants, we don't have nurses in the clinics. It's just a medical secretary who brought the patients to your room one by one. Then we fill out our visit notes, but there's no coding, there's no ICD-10 codes, there's no CPT codes. We just put our diagnosis and it's fine. So we didn't even know what medical billing was back then. And so yeah, that's our background. That was the question that George wanted to ask. So we were both doctors, but I don't really think that's added significantly to how we managed to make the business grow, other than actually understanding the articles from LinkedIn. So
yeah, sometimes having a background, of course, in the medical field is useful, but as you know, most of the people that come through our training don't have any contact at all with the medical field, much less billing itself. So it really probably did help you somewhat. Terminology and things like that probably came a little bit more natural for you. But as far as building a business, you're just like any other doctor out there, as we told you in the classroom, Albert, and I remember saying this and then looking over at you like, I hope I'm not, offending you, but most doctors are not good business people.
Yeah, I can attest to that.
Right. All right. So I think that answered Fabian's question there about, do you have experience in medical billing? You didn't really have any experience at all.
We didn't even know what medical billing was all about when we moved to the United States. So it's not an issue back there.
Yeah. So here's an anonymous viewer. They didn't put in their name, but anyway, they asked the question. It said, missed the beginning of the webinar. How did he get his first client? It was through LinkedIn. Is that what you said? Or
Well, I created an account in LinkedIn, but the contact did not actually come from LinkedIn, things like that. So, like I said, there was a brand new practice in town, and they were not very busy. I got to hang around there. I just wanted to position myself as the first one in line once their biller messes up, and
that's
that's
a good way to put it. Yeah, I like that. Hey, by the way, I've got your picture back up here just because we didn't really address Army. She's not there in the office because you say that she actually works from your home. Is that right?
Yes, yes. Before we both worked in the office, but when we needed to hire more people, we needed to free up the desks. So we set up a home office, and that's where she works. She works every day. Actually, the setup is such that she does a lot of the supervision of the employees. She reviews all of the claims that they create while I do most of the talking. I sort of act as I'm the one who goes to meetings with all of the doctors every day. But, it's part of the client care. So,
Well, and you're positioning yourself as the guy that knows it all. And if they ask you something you don't know, you just tell them, I'll need to get back and do some research on that.
Right from the start, I tell them, I may not be able to answer all of your questions, but I promise to find the answer for you.
Yeah. Let's see. Alan wants to know what types of providers do you bill for?
Yeah, right now, most of our providers are primary care or family medicine practices. We have an internist, we have a physical therapy practice, and we also have a pediatrics practice. But the bulk of my primary care practices, for some reason, the niche we found in the industry is in the home visit doctors segment of the market. Yeah, a lot of our doctors are actually home visiting doctors. We were kind of successful in having the word of mouth spread across that niche in the industry.
Yeah, sometimes that's true with a lot of licensees. They'll go out and find their first client, whatever it is, podiatrist, and all of a sudden they become a podiatrist billing specialist because that's who that podiatrist is going to refer to them. And you said a lot of your clients came from referrals.
Yeah. Mm-hmm. Yeah. Mm-hmm.
Let's see. We should address this as well, Albert. Just so people understand, sometimes we tell people if you've got other things going or you're working a full-time job, you may not be able to get out and get going as fast. And that was true in your case, wasn't it?
Yeah. So what happened was when we were having the training, I was actually working full-time. But right after the training, I lessened my work hours by about 2 hours a day at first. So I actually went to my own office at around 3 in the afternoon and stayed here until 7. I was mostly trying to create some marketing materials or developing something. I even tried to start a blog or something like that. And then what happened was I decided that I realized that I needed to be able to go to doctor's offices. So I started taking Mondays off from that job. And then later I added Fridays off too. And those are the days when I started walking around bringing chocolates to the receptionists. So about 5 months later, I said, I need to go full time to this business. That's what I did. And I always prepared myself to go to any doctor's offices once an opportunity comes up. So even though I was alone in the office, I was in my suit every day, just so whenever there's a chance to pop up in some doctor's clinic that hour, I'm ready. So
that's a good way to run it. Run your business like you're really in business.
I can still remember the exact day when I signed my first contract. It was actually the day before Thanksgiving. Then about 3 months later, through word of mouth from that practice, I actually had my second contract, and that was in California, far away from us. Apparently, word of mouth spreads not only in town, around town, spreads interstate too. So
right.
I signed that up, and then 2 months later, we had our third contract, and it was across the continent in Florida. Kind of crazy, right? Then, the following year, so it was December 31st of the following year. We were going to spend New Year's Day in California, and I decided to pass by the practice that we were billing for there. And lo and behold, I didn't have any idea that day I would sign 3 contracts the same day. Kind of surreal.
Wow, 3 in one day.
That happened, but then maybe every 2 or 3 months we get a new contract. And actually, we scheduled this webinar like a week ago, but just the other night, like 2 nights ago, we actually got another client.
That's fantastic.
Difference after you get your first contract,
Yeah, that makes a big difference, doesn't it? Didn't you say that Army said that you walk different, talk different, and look different once you got that first client?
But I'll be making a confession here. Even the first client didn't know that we didn't have any clients back then. So you can't go around telling somebody I'm looking for my first client. Maybe if I was if I didn't have a company before, but if I was working as a medical dealer already, then it could be fine. I can always say that, I was a medical dealer for several years. Then I started my own company, but I was not a medical dealer. I didn't even know what medical dealers were doing. So,
all right. So it did take you 13 months. We addressed that on a couple of people asked about that, and that's why it took you so long. You were working a full-time job there for at least the first 5 months, and just took you a little time. So I guess the real question, Albert, is this. Somebody actually asked the question. Let me see if I can find out who that is so I can tell you who it was. Somebody said, oh, here it is, Tim. How long did it take you to earn a complete return on investment? In other words, he's talking about our license fee, I guess.
Yeah. I never really calculated that. I will be honest with you that during the first few months, even when we already had our own clients, Army and I, there were times when we talked about, was it worth it to pay for the license and things like that. But when we started, we never computed if we had an actual ROI, and I'm sure we did. I'm sure we already did. I just can't tell you how long it took. But the thing is, when we computed what we're actually saving using iClaim, because we are licensees, I'm not saying that a non-licensee can use iClaim. What I mean is, if you compare this with some other software, and because we're paying, whatever expenses we have for iClaim is sort of worth it, especially because the other software brands would be more expensive. If you compare the features, it will be the savings that we had is much, much more than what we had to pay for the license fees. And if we're going to do it all over again, we're not going to do it any other way.
Well, good. Hey, that's one thing a lot of people have questions about. Our system, of course, since it's a cloud-based system, does have a usage fee each month. And that is something that you work into your pricing for the doctors, right? To make sure that that's covered. So they're really the ones that are paying for it, but you do have an expense there.
Of course. Yeah.
Let's see. Chanel said something about that. Do you seek out and sign your own clients, or did you use a headhunter or a sales rep?
Well, I tried doing that. To be honest, I tried doing that. That was one of the things you taught us. I was never successful in looking for somebody who would do the sales pitching for us affordably. There would be people who would be willing to do that, but they were like charging $4,000 a month. But we didn't have any clients back then. There's no way I could. Probably in your place you would find somebody who would do it for commission. Here in our place, there's just a few of them, and I didn't find any. Now, there was one thing that I tried. There are companies that you can find. One of the things that will happen when you sign up for LinkedIn, to be honest, is that you'll get a lot of sales pitch from other companies doing some other kind of business that want to tie up with you. And I've already told you how shy I am to make these cold calling things, door knocking, try to, networking, whatever. I'm too shy to do that. So we found they found us. There's a company who would sort of, because they knew our clients would be doctors, for a fixed amount, I think it was $99 a month or a week, actually a week. They had this impressive Excel file of doctors' contacts of the town where we're at. Didn't work. First of all, that impressive Excel file, when I started to review it, some of them were Walgreens, CVS. How do you get those clients? And then what happens is that the thing that they do is they actually try to call the manager, try to set up an appointment for me to talk on the phone with them. I mean, I thought they would be doing the sales pitch. Apparently, what it turned out to be is that they're going to set up a phone appointment for me. And when I try calling them, oh, we don't have time for that. You don't have. You'd better spend your time and money just knocking on their doors.
Yeah. Well, that's why in our training, as you know, Albert, we try to talk about finding your own sales reps and working with it. And it's been very successful for some licensees.
Yeah. I heard.
Again, that's why we have so many different ways to market. Is some things fit your personality, they fit your budget, they fit your time, and some don't. So you use whatever you can, Let's see. So that answers Tim's question about whether or not you use sales reps. Let's see. Parandama says, why only ABS when there are so many online medical billing systems out there and lots of doctors have access to these systems? So I guess the question is, why would a doctor outsource their billing to you?
Well, okay, I'll be honest with you. Not every client that you find is actually looking for an EMR and a billing software. Okay. Some of them actually have their own EMRs and they're not willing to part with it. So you're on your own as far as looking for whatever system you need to use in order to submit these claims. But the beauty of it is, go ahead and let them use their EMRs. One day they're going to vent their frustrations, and that's when you start pitching EMRX into the sales system. Well, I mean, don't try to force them from the very start that, oh, we also need to change your EMR. That's one thing that we learned. Eventually, when you're already a trusted consultant or whatever, you'll hear all of the different complaints they have with their own EMR, and that's when you pitch in EMRX. I mean, as far as our experience goes, that's how we do it.
Yeah. So what he's saying, folks, is that a doctor might be willing to turn over their billing to you, but they may not be willing to change their electronic health record system that they're using. Ours, called EMRX, is something you can introduce once you've got your foot in the door doing the billing, and they might want to switch to it.
And Patrick, I'm going to make a confession. This is the first time you're going to learn this. I didn't even tell Army that I was going to confess to this. I can feel for all of you that don't have your first clients yet. The truth is, you're kind of desperate. I mean, you invested money, time, and dreams into your own business. So that first client of ours didn't care what billing software we used. They just need us to submit their claims, right? They had no plans, absolutely no plans on changing their EMR, and absolutely no plans for spending anything other than our percentage, right?
Yeah, so the percentage you charge for the money you collect. Yeah.
Yeah, and 13 months have passed. We were paying the rent. Of course, we were paying ourselves, even if we didn't have any client. Remember, I quit my job. So when we needed, and he was kind of lowballing us. And one big mistake is that I accepted a very low offer, but I was just desperate for my first client. The very first software that I used was not iClaim. I looked for a very affordable software. I found something very affordable, but remember, I haven't billed for anybody yet. I haven't tried submitting any single claim. I didn't know any better. Apparently, that billing software was very cheap because the price that was quoted for me per provider was only good for 30 claims. What practice submits only 30 claims per month? Then after that, the price per claim was significantly higher than what I would be getting from iClaim. So it turned out that I was submitting, like, I don't know, the first 2 or 3 months, 200, 300 claims, but I was already in the 4 digits as far as what I'm paying the software for. And I was stuck with that for 1 year. And guess what? The first day that my 1-year contract with them terminated, I was with Jordan. I was setting up my iClaim account. I did nothing else. So, I mean, I just had to come clean to
That's
and confess to you about that. So.
Well, Hey, it has a lesson for everybody, right? That you may think that the grass is greener out of the other
Oh,
side.
yeah. We've always said that the grass may be greener, but it's not necessarily sweeter. So and that I can share with you some other misconceptions that Army and I had before we started marketing. Um, and the reason why I'm bringing this in is because one of the things that we always uh, out about iClaim is number one, it's completely web-based. We thought every software that said they're web-based or cloud-based was the same. No, that other software that we used, because we looked for something web-based and they said, yeah, we're web-based or something like that. Well, it turns out, yes, that you need the internet, but you're actually installing something in your system. So you can't use any other computer. So they're not totally web-based, not like iClaim where you just need to go to a website, log in, and you don't even have to take care of the security of your data.
Right.
Another misconception that we had when we were having the training, Army and I were already talking about this. I don't think doctors care about having access to their EMRs with their iPads. I mean, why would they want to access these files outside of their office or something? Nope. Big selling point. They love using their iPads.
Yes.
Whatever that are in the
Nowadays, doctors have all kinds of reasons for even in the evening at home or on the weekend, tapping into their data and being able to see the status of their claims.
Exactly. Yeah.
It's all right there for them. It's a great system, isn't it?
And maybe the last misconception that we had, we always thought that every clinic already have a biller. It's a matter of trying to grab the business. Well, no, we found out, we're actually surprised that there are some clinics, especially small ones or the ones with a aged old practitioner or something. They actually don't have a formal biller. There's a manager who submits the claims on the side and they didn't know what they were doing or something. That's something that we were surprised. We thought every practice already has a biller. It's a matter of trying to grab their business. No, it's not.
No, they're sometimes just doing stuff, like you said, just farming it out to somebody that they know, or they're struggling really. Most doctors, when you realize how backwards they are in their business, because they're, like you said earlier, they're not good business people. They don't know what they're doing. Which is good for us. Somebody says here, so did you, Irene says, did you get the rest of your clients mainly from referrals once you signed up your first client?
Yeah, word of mouth. You'll be, the first few clients were actually interconnected to each other. I mean, this one, number one, new number two, new number three, new number four. But actually, I think the 9th and 10th, or maybe the 8th and 9th client that we signed up, you'll be surprised. It was their old biller who recommended us, and we didn't even know the old biller. It's just that they were trying to get rid of their smaller clients, maybe, or I believe there were some health issues with the owner of the billing company, wanted to scale down or something. Yeah. But that was around October when ICD-10 was coming up. I think they didn't, I think they didn't want to have to adapt to ICD-10. Yeah. Whatever the reason is, but they heard from somebody that we were doing good business for this clinic. That's why the old biller was the one who recommended us. So I was surprised. I didn't even know them.
That is great. In fact, the rest of her question is, did you have to ask for the referrals, and did you provide an incentive if that was the case? Doesn't sound like you had to provide any incentive. They just wanted to have somebody do their billing.
No, I was willing to give an incentive. It just turned out that we didn't have to. Like I told you, I tried to hire salespeople, and those salespeople would have incentives, right? That's what we were planning to do, but we were not successful in finding some good salespeople. But as for the other referrals, I mean, we were willing to give if that's what it takes, but it turns out that was not necessary.
Yeah. Okay, so Charles says, Albert, would it be a wise decision to stick to the program that you were trained to do? It seemed like you would have saved some time and money rather than trying all those other things on your own.
Yeah, looking back, yes, like I told you, we already spent some. Learn from my mistakes. Don't do them again. We always went back to the basics at the end of the day. So
yeah, Marcus says, have you had to directly deal with competitors? And if so, how did you handle it?
Well, I had to deal with competitors in the way that, in the manner that, so there was this billing company doing business for this practice and they messed up. And then we came into the picture. It's not like we came in and proposed ourselves to replace them. It's the practice who called us to do the billing for them. And I think there was 1 or 2 times when the old biller was not cooperating, but you can always make do. I mean, the biggest problem there is number one, having your software connected to their payers. If you don't have access to the online system for connecting your software to their computers, but you can always call the payers and have them set it up for you. Other than that, you don't even need to talk to the old billers or whatever.
Yeah. Okay, so Parandama says, how do we convince office managers not willing to relay the info or give access to the doctors? Do you have a big problem with that? Are there gatekeepers?
Yeah, like I mentioned a while ago, I think it was Bonnie who told us that they're actually called rejectionists. I'm talking about the receptionists.
Rejectionists instead of receptionists. Yeah.
I always had problems with that, and the managers too. I always had problems. I'm able to talk to the managers. I don't know if they were actually talking to the doctors. I don't know what the answer to that is. We've gone through that phase. We were never successful in, like I told you, none of our clients came from the cold calling. Like today, I knocked here, talked to the manager and talked to the doctor, and I got them signed up for us. No, nothing happened like that. It was always months of working with them as friends, not as their billers. It's never easy. I never had a client instantly like that. It was always several months of being a consultant to them, except for those 3 clients. I was really surprised. It was a word from mouth from my one and only client in California, and we got 3 more.
Now,
I mean,
let's see.
So.
I guess I really haven't ever asked this question, Albert. You're in Nevada, and you say that your first client is in California?
No. My first client was here in town.
Oh, okay.
But the second one is in California.
I see. And then he referred you to another doctor in another state?
In Florida.
Florida. Wow. So you got a nationwide business, coast to coast, literally.
Say that. Right now, one is in Florida. There are 4 in California and 6 here in Nevada.
Wow. So a total of, was that 10? Yeah. 10 practices?
Yeah.
Did I do the math right? Anyway, I guess I was...
5 here in Nevada.
Yeah.
4 in California, 1 in Florida. Yeah.
Okay. And 44 actual, maybe 35 actual providers.
Yeah, because some of the doctors were in both practices. And that's how the word spread, actually, because they were also working with another practice. So.
Oh, and they said, hey, Albert's doing a good job for this practice. Why don't you switch to him? Okay, good. All right. Here's one from Jonathan. He says, can you give us a feel for the monthly volume that you actually bill out for doctors or collect?
Okay, I can't give you the exact figures. I just want to tell you that some of our clients are very small. Some are fairly mid-sized, especially the last 2 practices. If you remember, I told you that the first few clients we had were all the home visit practices. So those are fairly small practices. Maybe I get maybe $2,000 for each one of them, 2 to 3. For the other ones, for the larger practices, we sort of net around 5 a month. I mean, I can't give you the exact figures right now.
Hey, sounds like a full-time business for sure.
We make good money out of it. So. And to be fair to me, you're the one who characterized us as successful. Right now, Army and I don't consider ourselves successful yet. We're still hungry for more clients. We feel that we have more room to grow.
Anybody who's running their own business, to me, is successful. They're not going to work for somebody else,
Yeah.
Let's see. George says, is all of your business in the billing, or do you also offer some of the other services?
Oh, yeah. Okay, so all of our business is in the billing. We decided to make that our bread and butter at first. And what I mean is that we were thinking of making this as the main thing in our business while doing the other things in the package. But we honestly don't have enough time for the other services, and we don't want to sort of give not give 100% of what we can do to the billing side of business. So right now, that's the only thing we do. But I'll tell you that during the first few months when we did not have any clients, like I said, once you're signed up with LinkedIn, you get a barrage of offers from whatever. And maybe that's the reason why it took us 13 months, because we were distracted. We even signed up to be like dealers for one particular brand of in-house pharmacy products. We kind of sort of became distributors for mobile ultrasounds. We were even like distributors of these check-in tablets where you swipe the credit card information. We were like we signed up for the to be distributors of the service where you sort of take care of the online reputation of practices. We did all of those things, and on hindsight, we think that was one of the reasons why it took us 13 months. We were so distracted, and we went back to basics. Billing it is. Let's forget the rest.
Yeah, well, that's one of the nice things about having not being a franchise. As a franchise, you'd have to just offer what we, as a company, offer you. But you can branch out into anything that you want to, even though you found out that it's not really as profitable in some of those things as you think it would be. Celia says, how many employees do you have?
Well, so aside from me and my wife, we have 2 part-time employees and 2 full-time employees.
Okay. Matt says, do you bundle other applications with your iClaim package?
I don't necessarily understand what that means.
Yeah, maybe he's thinking that you're actually selling the iClaim software or something to the doctor. But Matt, we're just telling you about iClaim because that's the system that we, Albert, to use to do the billing for the doctors. So, okay, well, hey, it's 3:57, Albert. Thank you so much for your time today. This has been very interesting, and I'm sure very encouraging to a lot of people who are thinking about getting into this business.
Well, it was my pleasure.
All right. Well, Albert, you're welcome to go ahead and leave the webinar if you wish at this point. I'm going to just finish up with a couple of the slides here. Thanks again, and we'll be talking.
You're welcome.
All right. Bye for now.
Bye.
Folks, we do have another live training workshop coming up for those of you who are on here that are looking at getting into this business. As you can hear, it's very profitable. I didn't do the math there in my head as Albert was talking about the clients that he has, but it sounds like he's doing fairly well financially. And even though it took him a little time to get to that point, folks, everybody is different. Everybody is different as to whether they get to the point where they're at with 44 or 35 providers or whatever it is that Albert has. Some have more than that. Some have less than that. We have licensees that have 300 doctors that they're billing for. So, and then there's some that have a handful and they're happy with that. Okay, so anyway, that live training workshop is coming up. Here's our phone number, and if you want to, you can also email us if you'd like to know more, or if we didn't get to one of your questions, just email us at info@absystems.com, or you can call the toll-free number you see there and talk to Hannah, who answers our phone there at our offices, and she'll be glad to get with you. Hey, by the way, next week, we're doing a webinar, same time, 3 o'clock Central Time on Wednesday. What do I get for my investment in this business opportunity? We're going to cover every single aspect of what ABS provides you as a licensee, including all the pieces of the marketing package, the training, the lifetime support. We're going to show you our live licensee support site. You'll get a few tour of that. You'll learn a little bit more about our business development coaches that we have that can help you in making the decisions that you need to make to get started in your own business. Folks, if you're trying to get into that training class, though, be sure and get your paperwork done, get your due diligence done, do whatever research you need to do, and get your paperwork back to us so that you can reserve a seat in that class. There's only 8 seats left, as we said earlier. And by the way, we do have a money-back guarantee. If you come through our training and decide this is not the right business for you, you just tell us and we'll give you all your money back. Now, don't ask us how we do that. Because people are always asking, how come you're not going out of business? Couldn't people just come down, go through your training, and then get their money back and go start their own business? Of course they could. But you'll see when you come to the training that it's well worth the investment that we have for you to get into this business. And we're going to cover that next week in detail in the webinar.